Hi everyone. In this video we'll be discussing about ureter, its development, its constrictions and its anterior and posterior relation, blood supply, everything about the ureter. So first, what is the development of the ureter? It is developing from the ureteric diverticula arising from the mesonephric duct. Basically from the mesonephric duct. Then diameter of the ureter is 3 mm. And then we have three important constrictions in the ureter. The first one is at the pelvic-ureteric junction, at the junction of pelvis and ureter, where it is originating. Then at the crossing of the brim of the lesser pelvis near the at the pelvic brim, where it is being crossed by the iliac where it is crossing the iliac artery. Then at the vesico-ureteric junction, where it is entering into the bladder. So this there are three constriction, and the narrowest part is here at the vesico-ureteric junction. Then we have the anterior and posterior relations. First, coming to posterior relation. In the posterior relation, we have the psoas major muscle. So ureters are lying over the psoas major muscle. We can also remember by comparing with the anterior and posterior relation of the kidney. I have already made an important video on the anterior and posterior relation of the kidney. So from that we can remember. In that it was psoas in the medial side, then it was quadratus lumborum, and then was transverse abdominis. So medial most muscle is related to the ureter. Then we have the anterior relations. Anterior relations are separate as there was for the kidney. So here also they are separate anterior relations for the right and the left ureter. On the left side we will be having left colic vessels, sigmoidal vessels, and left gonadal vessels and sigmoid mesocolon. Basically sigmoid is there on the left side. Then on the right, we will be having second part of the duodenum, right colic, ileocolic, and right gonadal vessels, and root of mesentery. So on the right side, we have the duodenum and the mesentery and the ileocolic vessels. So that is about the anterior relations of the ureter. Then coming to the blood supply. The blood supply is not that much defined, so it is getting its supply from the surrounding vessels, that is from the renal vessels, then from the gonadal vessels, then from the common iliac and internal iliac, which will be running in this region. It will be getting its supply from that, then from the vesicle, means bladder vessels, and uterine vessels, and abdominal aorta. So, what all the vessels lie in this region can supply the ureter. And lymphatic drainage is to lateral aortic nodes, means aorta will be coming up to this level. It will be draining to the lateral aortic, and then it will be dividing into iliac arteries. So, it will be draining into iliac nodes. And what is the innervation? Innervation is basically from which level the ureter is starting, that levels will be innervating. Like here will be T10 to T12 vertebrae. So it will give nerves, and the nerves will be coming down and innervating the ureters. T10 to T12, first lumbar, and S2 to S4. S2 to S4 segments. S2 to S4 segment also contribute to the bladder supply, that is nervi urgentis, parasympathetic supply. So S2 to S4 will be also innervating the ureter, and also from the renal and the aortic plexus, renal and aortic plexus, and superior and inferior hypogastric plexus. So nerve supply and arterial supply is not that definite, it is from all the surrounding structures only. So that were all the important things about the ureter. The relation, main important thing is about the relations of the ureter and about the constructions of the ureter. I hope you will find it useful. Thank you.